All right, thank you, Jody. We will go ahead and get started with the September 9th IDD committee meeting. We have two presenters today. I asked them to help pronounce their names before we started, and I've already forgotten one of them. So first we have Sharon Costabile.
Costabile.
Costabile. I knew I was going to mess it up. And Wendy Pligge. Wendy's was easy after she pronounced it one time for me, but Costabile is going to give me nightmares. So Costabile,
It
Sharon,
does me.
Sharon Costabile and Wendy Pligge are with Engage Illinois. They have very lengthy and wonderful bios, but rather than read them to you word for word, we will just put those in the chat, and I'll let Sharon and Wendy introduce themselves further so they can begin their presentation since we did have a few technical difficulties.
Okay, that sounds great. Again, I'm Sharon Costabile. I'm actually one of the founders of Engage Illinois, and also have a daughter, Rachel, who is just turned 40 a couple weeks back, and she has Down syndrome. She lives in a two-flat with one of the apartments with Wendy's daughter, Ruthie. Wendy, you want to go ahead and introduce yourself?
Yes, I am a parent, a retired school teacher, and very involved with Engage Illinois. I met Sharon kind of like a friend told a friend told a friend. So it was all purely accidental that we got together, and the girls clicked so well that they are now roommates. So my daughter is 36, and she has an intellectual disabilities.
Thanks, Wendy. And I do want to thank Lynn Canfield for introducing us to Kim and Jody. And we're hoping that we can continue to collaborate as time goes on here, because together we are definitely better in the state of Illinois. And we appreciate everyone's help, input, and collaboration. So I'll go ahead and start so you can understand a little bit about where we came from. Wendy, if you'd be so kind to text me if for some reason I lose contact, but I will start with our supported living model, and I assume I can share my screen, right, Jody?
Yes.
Okay, here we go. Let's see if this works, guys. Okay, can everyone see my screen?
Yes.
All right. We refer to the home that our daughters live at as the 209 home. So if you see or hear me say the 209 house, that's what I'm referring to. So these are the choices we have in Illinois for where our folks can live. When we started working together with originally thinking we were going to be looking for a Scylla for my daughter Rachel, when she raised her hand one day and said, I want to move out. I said, okay, well, let's see if we can figure that out. We called an agent, several agencies actually. In 2019 is when we started that and realized, we were going to choose box A, which was the Scylla. As we went along with probably the addition of COVID involved, we realized that it was taking longer than we expected. So 19 is when we started the process, and by 2021, we were being told that nobody wanted to move out. There were no other people looking for places that would fit with my daughter. And so I started to think about other choices. At the same time, we met a young lady named Ashley through a friend of a friend whose mom had been diagnosed with cancer and was dying. Father had already died. So met up with Ashley's brothers who don't live in our immediate area, and we agreed that Ashley and Rachel would be a good fit for moving in together. So we now had two roommates. I communicated that back to the agency, and what happened was they said that we couldn't do anything until we had 4 people. That was what was going to make it work in the home that my husband and I own. And then they would be facilitating the support program in that home. We waited a little bit longer, and by December 12th of 21 decided, with the help of my team, which is this is before Ruthie became involved. We just had Ashley's brothers, myself, and a handful of other folks that are part of our support system. So we decided to move ahead to Box B, which is home-based, and we were searching for something that was more of a hybrid of the two. And as you can see on the screen, you know, the things that we were kind of looking for. Oops, excuse me, did I miss my screen? Can you see my screen still?
Yes.
Oh, you can. Unfortunately, I lost it. Hold on. Yikes. I hit a button and it went away, guys. Speaker. Nope. I'm so sorry. Meeting.
Well, I think what you
Oh,
were trying to say was that we were searching for a box C, which does not exist.
Exactly. Exactly. Thank you, Wendy. So these are the things that we were kind of looking for when we realized that we were going to have to do this ourselves. We were looking for these items, you know, something innovative and flexible, person-centered, you know, community-based, which we already had the home. Sustainability, which is, you know, the fear that all folks who have a kid with a disability fear that, you know, what happens when I die. And we wanted something that was based on what the girls needed. And that was equitable. Okay, yeah, I'm in trouble.
Would you like me to share? I can pull this up for you, Sharon, and then I can just switch through the.
That might be better because I can't seem to, it's not moving very easily.
No problem. Let me look. Let me get it and ready, and then I'll pull it up here. Hold just a second.
Okay, my apologies, guys. And unsharing, did I unshare?
We still see your screen. I do. Oh, now you're gone.
Okay, now you have the, if Jody, if you can pull it up, that'll be helpful. I'm so sorry.
Okay, I just have it. Hold on, just one sec.
See, she's nice and young, so she's really good at technology.
Not quite. It's
Okay.
a facade.
Okay, you can go ahead and advance. Now go to the next one. There we go. So we realized this is what we were looking for, something called supported living. If any of you are familiar with John O'Brien, who recently passed away, he many years ago was able to identify more clearly what exactly supported living is all about. And he was quoted to say, "It is helpful to define the edges of supported living by saying as clearly as possible what it is not." So we began to say what it is not. And you can kind of read some of those things. This is his illustration. And we realized that creating a life for someone based on their needs, choices, and interests was what was important. My daughter's very outspoken about what she likes to do, what she, what she needs. And so having those kind of opportunities that would be available was what we were looking for. And the ability to decide who she was going to live with. Now that we knew we weren't going to do box A and we were going to just wing it, we had to develop a way to do that. Would you advance, please? So we started looking at, these are the 3 roommates that currently live together. Ashley is the one whose mom then passed away as we were going through this process. And Rachel is my daughter, sitting next to Ashley, and Ruthie is standing above the two girls. We realized that we wanted the choices that people have when they live independently. They have the capacity to direct their life. And that's kind of what we decided was important. Next slide. So this is what they needed: a flexible, innovative, supported living arrangement with just a dollop of everything: dreaming and fun ideas and choices and routines and friendships and outings and, working and living in the community. Next slide. This is my daughter's expression of what she likes to do. She likes to make plans. The girls do have a small business that I'll mention later. It's called Just a Dollop. She likes to look for recipes to try out. She likes to look for food and fun activities to make and desserts. And she loves to plan business trips together. And you see her with a combination of activities there. Next. This is Ruthie's expression of what she wants. She likes to try things out. Again, she likes to test recipes with friends. She likes to take the cookbooks and sell them. Her mom, Wendy, and I and the girls do a lot of activities around this type of thing because they produced a cookbook and we love to travel together. So these are all the things that Ruthie talks about liking to do. Next. This is a video that the girls made together. And it's all about the cooking that they do. They became very involved with this. So this is another item that they really enjoy doing. Next. They wanted to start that business. And so we did, with the help of Ruthie's aunt, Wendy's sister, publish a cookbook of all of the healthy recipes that they researched. They were on the journey for weight loss and healthy living. And the three girls that lived together combined lost over 150 pounds doing this. So it was definitely one of their goals. Next. Doing these things together is what supported living is all about. And very early on, we realized that they needed to speak up for what was important to them. And so we began to include them in a lot of advocating. Surprisingly, they all love doing this. On the lower left, you'll see they created a video for the Going Home Coalition and Rev Up Illinois to get the vote out, get people out there and sign up and register to vote. At the top left, we went to Springfield and the girls were recognized with a House resolution for the life that they have created for themselves in Naperville in a home of their choice, with doing the activities they love, and they were acknowledged for starting their own business. The bottom right, obviously, we all know what that advocating is about, so I'm not even going to go into that. Next. So life at the 209 home jump-started changes for us. In September of 23, we formed the Creative Housing Network. That's a year ago today, actually, 2 years ago today. May 24, the Creative Housing Network, together with our folks with disabilities, reached out to do a strategic planning meeting. Ryan Croak, some of you may recognize, and Director Pehoff and Secretary Grace Howe. Ryan received a letter that I wrote to Governor Pritzker, a 10-page, 11-page letter with lots and lots of, I guess I kind of like statistics. So I sent forth some of that. Ryan called me and said, let's talk about this letter. And I said, well, let's do it at a strategic planning meeting. Would you be willing to pull together some participants? He said, absolutely. And so that was the beginning of the planning for the North Star Plan, which is the next item. One of the goals of the North Star Plan, with the 70 folks that came to Springfield, which included those folks you see, also included people like, Lynn, were you there? I can't remember if you came or if you were on video, I think, a Zoom. But we had tons of interest and participation by key stakeholders like Kathy Carmody from the Institute, Kim Mercer-Schleder from the Council, Illinois Council, Kim Zeller from Ray Graham. We had a number of other providers, CEOs from them, and quite a few individuals with disabilities. Then in January of 25, after the plan was developed and the goals and timelines were set, it was established that Engage Illinois would be the first goal, to create a coalition to gather together and kind of keep things moving, keep pulling people together and building something that we could take to our administration in both the division and the government and say, this is what we the people want. We were able to get a Coleman grant for the infrastructure. We established a steering committee and subcommittees, which included an outreach, legislative, and communications. And we began starting to build the coalition and networking. Next, please. So we know that together we do have power. We've learned that over the years, and we want to create equity and dignity and choice for our family members with disabilities. Most of all, we would like it to be something that's sustainable. And we know that sometimes that path is not the easiest path. So we want to make sure that we reach out to as many folks as we can to join us on this in this endeavor. And I think Wendy's going to go next. If you want to, Jody, I don't know if you have that one pulled up.
I don't have that one. Let me pull that up. Or Wendy, are you able to do your, you're presenting, Wendy? I mean, do it. I'm happy to scroll through as well. I think you're on mute there, Wendy.
If you could please do it. I'm not sure how to do it, and I don't want to waste any more time with technical issues. So
Okay,
if you could pull it up.
yeah,
please.
hold one sec.
While she's pulling that up, I just want you to know that we're very interested in feedback on our presentations as well. So after you hear the whole presentation, if you would be so kind as to send us a little bit of feedback on understanding and, you know, if it's complex or not complex, your perceptions of how that is going.
Okay, I think I found it here.
And you'll have to let me know if you can hear me okay, because of course they just came to cut my grass. So if you hear that in the background, that's what's going on.
Is this a correct one right here?
Yes.
That's
Okay.
it.
Okay.
Okay, great. And since January, we have officially launched our Engage Illinois Coalition and are gathering members as we speak. And our vision is that individuals with disabilities design their lives and they have a choice. So one of our goals is to make sure those choices are there and people are not just accepting what is offered in whatever limited capacity it is right now. Our main mission is to get individuals and family voices out there so people hear loud and clear what we want, what we need, and what's best for us. And again, not just take the status quo of what they're offering at the moment. Okay, a little bit of history. I assumed I knew some of this history, but I was very surprised by some of the things I learned. Initially, institutions were developed to educate people to become productive members of society. didn't remain that way. Unfortunately, over the years, it shifted more from education to custodial care. And that's kind of where we are stuck. That's what we have now. Medical practice more than anything to try to get people into the community. You can switch. And some of us may have heard that Illinois ranks very poorly as far as the way they use their money to support people, especially in the community. A lot of money goes simply to the brick and mortar and not the services to the actual clients. We still have in Illinois 7 state-run institutions, whereas most states at this point have none. And it is a default placement if there is no other option. Like Sharon talked about our roommate, Ashley, who lost her parents. And had she not met Sharon and been able to become part of 209, she was headed to an institution. And next page. The continuum of funding models. This is what we have currently. The federally funded default models are the institutions and the ICFDDs, the community facilities. The waiver programs, which are your group homes, and the home-based program, which many of us are on right now, because that kind of turned out for us to be the default because the availability of group homes is very small. Now, the more progressive model, which is what we would like to see more of, the community supported living model, is really not recognized in Illinois. That's where we are creating kind of our plan C, which is, our private setting that we have now. And switch. Now, this statistic floored me. Our state operated institutions have an estimated annual cost of $350,000 per year per person. And we know that each person is not getting $350,000 worth of care. So, you're talking a lot of overhead and bricks and mortar maintenance there. And the intermediate care facilities estimated cost $150,000 per year per person. And we kind of feel that that may not be our best allocation of those funds. Next page. The waiver programs, we have the SILAs, which are your group homes. And this established model, 1981, has remained pretty much the same. It's needs-based, but not person-centered. It is run by licensed providers, which means they pretty much make all the decisions. Estimated cost, $80,000 to $125,000 per person per year. And one of the issues with this is that they have the choice whether or not to accept individuals with high medical and behavior needs because they don't always have the supports necessary. The home-based program is actually based on a stipend 3 times your Social Security. So it's approximately $34,000 a year. And, you can see right away that that's a much less of an amount than the other models. It was intended to provide funds to keep your loved one at home until a better housing option or a SILA became available. It's kind of turned into there isn't anything available. We take the home-based funding, and at least in my case, my daughter does not have high medical or behavior needs. So when she was living here, I used the home-based funding to pay for recreation day programming and transportation. And for us, it was adequate. But if you are trying to run a community-based home, self-directed, it is by far not enough for that. And people are choosing it because there isn't any other option right now. And one of the things we want to make sure our government and the powers that be realize is that people are taking it because that's all they feel they have. The government will try to use that 80% to statistic and say that, well, we are meeting the needs of all these people. We've met our requirement. And in not either not understanding or not wanting to understand that people are taking the home base because they don't really have a choice of anything else. Next page. All right, here is just a diagram of where everybody is at this point. We're talking, over 31,000 people. And the biggest majority is taking the at-home based services. And what's our smallest percentage here? Oh, the residential for children, state-run facilities. So those are the group homes. Those are in red. Now
So we do, I'll just pipe in a little bit here, Wendy.
Yes, thank you.
We do know that this is fiscal year ending June of 24. So what we also know is that because the home-based selection is the one that the majority of the people are picking, that those numbers are Scylla. So what we're seeing is, again, that growing of home-based, the reduction of Scylla. Not to say that Scylla is not an option that some people find works for them. I think what's important to understand here is that folks need choice. And that's really where we're limited in the number of choices that we have. Thank you.
Thanks, Sharon. You can go to the next one. Okay, the more progressive model, which is the model Engage Illinois would like to see more of, is supported living. Here are some of the reasons it's more cost effective than the other models. There are better outcomes. I just said yesterday that I wish I had a short video of my daughter and just kind of an overall way she was before she moved in to 209. Now she's been there going on 3 years, and then a short video of her now. And you could see the change in her living in that kind of environment based on need and including people with high medical, behavior, and mental health needs. It is national best practice. It has robust case management, so people can really focus on their individual personalities and their likes and dislikes. And sustainable. Now, sustainability is where we right now are struggling a little bit, which is why we are looking at the funding model. Right, next page. We started Engage Illinois. One of our main purposes is to get a strong parent voice. Currently, there is a lot of opposition to closing the institutions because of the people that manage, work them, and that are actually profiting from them. So we would like to get our group of voices that are families and the people who are want the living in the community, so they hear us. And so that's why we started the coalition, to gather the voices and get a strong number of people so that we can be heard. Next page. And just what it says, we need a strong family voice in Springfield, representing our demand for better community-based options. And again, we're looking for options. Many of us, the Scylla model is a good model. Many times when there is a availability, it isn't near your home. So, if one of your choices is to be near your family, then we have to go to Plan C. And next page. We need a coalition, which is what we did. We are starting We have started the coalition. We are gathering membership and getting our name out there so people hear us. We're looking for thousands of voters to help move the governor's office, legislators, and the division to look at this as a more feasible model. Next page. Okay, we want equitable funding. As you noticed during the presentation, the home-based model is much differently based than the others. Next page. Join us. Yes, that's what we're here to request that people join us so that our voices are heard. You can go.
Thank
Yeah. And
Thank
there's, we've got 3 ways listed here of what you can do. There's no cost to join in the Engage Illinois Coalition. We always accept donations, tax exempt donations or tax deductible donations. And Connect Us is if you know somebody that would like to hear our message and have a presentation. We are, taking our show on the road to whoever wants to hear a little bit more about us. I think the next page is just more of the same. Yes.
Thank you, Jody. There's a couple things that I would like to end with. One is that we have met with a number of legislators. We have a very receptive legislative body. We met with a couple of the groups that they belong to, the Medicaid waiver work group and that type of thing. They are very willing to help us understand how they can. They want us to help them understand how they can support the work that we're doing and bringing the possibilities into legislation. So we are not at that point at this stage of the game, potentially because of the federal government and the fact that we have a distinct pot of money that has to be allocated across the service sectors. So the most important thing is equitable distribution of those funds. And the home-based services are not needs-based, as Wendy mentioned. They're based on 3 times SSI, so it's more of it was intended again as an interim before folks get to the point that they want to move out, so to say. So, but it's not being used that way because of the lack of options. And the fact that the state of Illinois is default base in institutional living, that's unfortunately the crisis coming around the corner now is that there are going to be more and more folks that are, as the aging population we have, dies off, unfortunately, it's going to put people in the position of needing to live in institutions again. So we want to try to do something before we get to that point. I'd like to open it up for any questions if anybody has questions of us at this point.
I'm really excited about you all coming to Champaign in a week and a half, 2 weeks.
That's right. That's
Wait,
right.
It's 2 weeks. Very excited. I just invited Senator Faraci, and I'll keep sending invites. You may already have a relationship with him. Later in this discussion, I have something to read to you, but it's not time.
Okay. Was everything clear, I guess, is the question. So we would love to look at opportunities to continue to build relationships here. And I look to you guys for input on what that might be.
You
The
mentioned
209 home is located in Naperville, Illinois. We do
Will
have,
that second PowerPoint be shared out, Jody, so that we have that QR code?
Oh yeah,
Yes.
yeah. I'll post it here in the chat room now.
we're happy to say that we have many individuals and family members with disabilities that not family members with the individuals with disabilities and their support systems that have joined the coalition. We have we're just over 500 folks that have joined the coalition. We are also looking to allies, to anyone who knows someone with a disability and knows how important these changes are. So we want to make sure that that our legislators and the governor and the folks with the division are aware of what our voices are and what we're looking for. I do have to say that I think we are positioned well in terms of the receptive nature of folks in the division. So that's an important piece that has in the past 10 years or so has not necessarily been the case. What was the question I just saw pop up?
About 708s.
So, have you applied for funds? No. And we're still becoming more familiar with the boards. I have to admit, I've not been familiar. I'm familiar with quite a bit, but the 708 and the what's the other one? The 577 boards. I'm not, I know Naperville has a board, but I'm not familiar with how it works.
And just for your information, the website is engageillinoisil.org.
And if you'd like to see more about what the 209 home is doing, you can go to their website, which is justadollop.org.
We've even had some meeting and collaboration with a group of people that have babies, with disabilities. So we're trying to get the word out to all age groups, even though, it doesn't necessarily need to be people that are ready to move out.
And I think that's another issue that came up during our Springfield planning meeting is educationally, there are a lot of folks that come through the educational system, get to transition, and then realize, gee, after transition, there's no givens. It's sometimes referred to as a cliff, but they're not actually prepared. So we'd like to get more information out to families earlier. We're going to be speaking with Stevenson High School parent group in September. We do have a number of meetings planned. We're also speaking with the Oak Park area, the township office. I see that you're from there, Melissa. And, not from the township office, I'm sorry, with the Oak Park board. And also there's an Oak Park parents group that we're going to be presenting to. We're also in conversations with Connect to Community, which is a large group up in Palatine. We're doing a presentation there in October. So we're trying to get the word out across the state. We're a small steering committee. So most importantly, we're looking for anyone who is interested in becoming involved in terms of outreach and networking. That's our next major need right now.
Have you shared flyers or anything with the ISC agencies so that when they're going out and meeting with families, they can
I have not with all the ISCs. That's a great question though, Kim, because I have spoken with an individual from Service Inc. in our area, and she's very interested in doing a presentation to the ISCs to get that word out to families. But that's a great suggestion.
And I don't know, I used to be an ISC, so the ISC agency leadership used to meet on a regular basis, so I don't know if she was speaking of just her. Service Inc. covers quite a broad area now, so I don't know if she was speaking of just her ISCs, but it might be worthwhile to try to do a presentation to the ISC leadership whenever. I don't know if they still have those meetings. I would assume they do, but if you
Okay.
could ask them about that, so you could hit all of them at one time.
Great idea. So I will check with my connection at Service Inc. and see if she can give me more information about that.
Is the 209 homes currently funded through just privately in your home-based supports? I'm sorry if I missed that, but how is that currently?
Yeah.
Say that question again. I didn't hear you.
I
This
heard it,
209
Sharon.
home, is that home-based supports? And
Yeah, we all have, each of the families involved have home-based supports, and everything else is funded privately right now.
So, and also, that notion of splitting apart bricks and mortar and services, I think is something that is a real important piece, because when the agencies are managing both the house, they own the house, and they have the services, they're getting money, they're getting the whole pot of money. When you put your child into a group home through an agency, the only thing they get is this $60 stipend a month for their own personal spending money. So that means the rent, the management of the building that the agency owns, that all takes place by the provider. When you split those and you have a landlord that takes on those responsibilities, then it opens up the opportunity for more flexibility from the folks that are actually living in the home. So they have, in our case, I happen to be the landlord. My husband and I bought this 2-flat 25 years ago with this thought in mind. And then when the girls moved in, we established a rent. They would theoretically each have a lease with the landlord. We haven't really pushed that since we're the landlord. But that's how it should work. And then, when that happens, it becomes a service package. And it's so much easier to be more flexible because the landlord manages all the nuts and bolts of the home. The agency is not responsible then for, fire extinguishing, for, the home being approved by the local ordinances. The landlord is responsible for those things. So I think that's something that nationally has been done. And actually, even in the state of Illinois, I think it's IAG, Individual Advocacy Group. I don't know if all of you are familiar with Charlene Bennett, Dr. Bennett's agency, but she's been very progressive in doing what I would call kind of a supported living in Scylla. She still has agency managed homes, but she does not own any of the over 120 homes that they have services provided to the folks living there. And all of the homes that she manages are, with the exception of, I think, 2 or 3, she said, Stanley Ligas is one of her clients. He's in a 4-person Scylla. Everyone else pretty much is in a 3 or under Scylla. So, it's not like it can't be done. It's being done. It's just that there are so many regulations that have to be followed that it's creating barriers for families to do this.
Sharon was the one who found and hired our staff. We have 4 women who manage the home throughout the week. So there is pretty much someone there 24/7.
Any other questions? Well, we'd like to thank you all for listening, and also for as you percolate some of the ideas that have come forth. And if you have any suggestions, we're very open to innovation, which we would like to see the state be more open to innovation, and appreciate any input that we can get.
And any questions you may think of later, just shoot them over to us.
Sounds good.
I wanted to share something with you, and this might be a waste of other people's time, but it's very important to me. So if you could indulge me, I just wanted to read you a quote that has to do with the National Ark,
Okay.
and maybe I just want to read it to you and then ask you when you think this happened. It says, a decade ago, 42 parents met in Minneapolis determined to improve the lot of 5 million children in the US. They started a nationwide demonstration that people with disabilities can be helped to develop, learn, and work. Will County is still far short of a truly adequate program of education and training for these children, but there has been important progress. Public facilities now include special rooms in the public school system, summer school for the pupils in the special rooms, and plans for workshops for young adults and adults. In 1950, when the parent movement was organized, virtually none of these facilities existed. This comment was made in 1960, but doesn't it feel like it could be today?
Yeah. Yeah. That's, it's, we, we think that we have moved from,
Mhm.
really institutional style living to,
Mhm.
our folks have rights, they're
Right.
citizens, they should be respected and they should be valued. And that's a great sign of the movement. I
Yeah.
recently graduated from something called Partners in Policymaking, which is a program that was established by the Illinois and funded by the Illinois Council on Developmental Disabilities. This particular group has been run by Alan and Jan Bergman.
Mhm.
And Alan is probably one of the most brilliant men I've ever met when it comes to understanding the Medicaid waivers and how each state varies in that. And
Right.
to that point, Lynn, so many more states have taken it upon themselves to move forward.
No, I know. That was my grandfather in 1960.
No,
One of the founders of Trinity School. And I just, because this is like my whole family history, my whole life,
wow,
I'm often impressed by how slow progress is and how little progress is made without parents.
yeah,
So here we
yeah,
are again, where
Always,
you
whenever
need
we speak,
thousands of,
yeah,
I'm sorry.
that's okay. I don't mean to interrupt either. I was just going to say that, we always like to acknowledge when we're speaking to legislators and government that there has been movement and, acknowledge some of the positives that there are, as well as going on to say, but, we're kind of stuck. We have a long way to go.
right. Yeah, and with the things happening in the federal government right now, there's a tremendous amount of fear as Medicaid and Medicare become, cut. And we're looking at, this is a lifeline for, folks with disabilities. And we are fortunate, Wendy and I, and our daughters are fortunate that we have the ability to do some of the things we've done. There are so many families that don't have that ability. And what drives us is that need for sustainable solutions for people. I had open heart surgery 2 years ago. I nearly died with breast cancer. So it's very real that, and it's inevitable. We all die. But when you have a child with a disability in your family, there's so much more fear because you do so much of what they need for them, and when you're gone, what will happen? So it's a crisis. Some have said it's a tsunami of need coming through the pipeline now. So
And
thank you for your.
we've been told through, many sources that this is a long haul. This is not going to happen overnight. The funding is not there. But with the coalition, we want to make sure we stay in the forefront and people know us and continue to hear from us that we're not going to go away.
So, and thank you, Lynn, for reading and that was your grandfather. Wow. Wow. Well, on a side note, I'd love to hear more about that later when we meet. Okay. Well, again, thank you all. And carry on with the good work you're doing. I look forward to learning more about the boards in the various communities. I think it's an untapped resource. From what I can tell, there's a lot of things that can be filled in to support families in transition, that have short-term needs, things that they're not getting from the Medicaid waiver or resources at a certain particular place in time. So thank you again for all that you do.
Thank you so much.
Thank you.
Thank you both for the presentation today. It was wonderful hearing
Great.
from you.
Thank you. Okay, have a good one.
Bye.
Bye-bye.
Thank you,
Bye-bye.
everyone.